So, hello, Professor. Would you tell us about you and about the area of your expertise in عجبادنا أعتقد?
Yeah. Hello again. I'm Dr. Ouzai. I'm assistant professor in the Department of Hematology and Bone Marrow Transplantation in Acıbadem University Atakent Hospital. I've been working as a hematologist for more than 15 years, and my area of primary expertise is bone marrow stem cell transplantation in treating the patients with hematological malignancies like leukemia, lymphoma, and myeloma.
Would you tell us more about the adult bone marrow transplantation program in the hospital?
Yeah, I think it deserves attention, the bone marrow transplantation of our institution, because actually we are one of the most prominent transplantation units in Turkey. Currently, we are the transplantation unit with most patients done per year in Istanbul, and our transplant number continues to grow up. Our program is directed to the patients who are more than 18 years old. Our unit does not accept patients under 18 years. We are focused on treatment of hematological malignancies, like I said, acute leukemia, lymphoma, myeloma, and also aplastic anemia, and in some cases, thalassemia and sickle cell disease. We perform about 200 transplantations in 1 year, and 1/3 to 40% of those transplantations are allogenic bone marrow transplantations. The rest of them are autologous transplantations, which we use mostly in lymphoma and myeloma, but we also treat patients with very different kind of diseases like autoimmune hematological diseases, people with bleeding disorders, and people with who need apheresis treatment, because we also have a therapeutic apheresis ward in our hospital where we treat patients not only with hematological diseases but also with neurological, gastrointestinal, and autoimmune rheumatological diseases. So we have an expertise in that area too.
Thank you. Would you describe us how the process of the transplantation is carried out?
Yes. The transplantation of the bone marrow and the stem cells of the bone marrow can be done in basically two different ways. In some of the patients, we prefer to do autologous stem cell transplantations, which is a kind of transplantation where we obtain stem cells from the patient itself. The goal of this transplantation is more frequently to obtain a long-term consolidation, I mean a long-term disease-free survival. And unfortunately, with autologous transplantations, very few of the patients can achieve complete response and complete cure of the disease. On the other hand, the allogenic transplantation really provides an opportunity and a chance for complete cure of the disease, especially in patients with leukemias and high-risk hematological malignancies. But here, we perform the allogenic transplantation from a certain donor, from a person who has identical tissue groups with the patients, or at least 80% to 50% identicity with the patients. The allogenic transplantation can be divided in three different groups. First, we do allogenic bone marrow transplantation from a sibling, I mean from the patient's sister or the patient's brother. If those patients who need allogenic transplantation cannot find a suitable donor for transplantation, they are referred to a bone marrow banks. We have one in Turkey, which is quite effective, and we frequently find suitable donors for patients who come from abroad. But even though we cannot find it from Turkey, we are in close collaboration with DKMS, which is the Germany's biggest bone marrow bank, and also with NMDP, which is the bone marrow bank of the United States. So sometimes we find donors from those countries too. But even though some patients still cannot find a donor, and in those patients we perform haploidentical transplantation, which means a transplantation from a donor who is at least 50% suitable, compatible with the patient, where we perform another kind of treatment before the transplantations to increase the success of the treatment. So basically we do every kind of transplantation which are done in the Western countries in the United States, and we also have a close collaboration not only with our Turkish partners, but also we are assigned to the American Society of Bone Marrow Transplantation and European Society of Bone Marrow Transplantation. When we are obliged to report our success rate and our transplantations, which are in turn being followed and reported by a certain committee of aforementioned societies.
Thank you very much, Professor.